My name is Alexander Milgrom. I'm an infectious diseases physician at Prisma Health. Infectious diseases is a specialty where we treat those various infections, be they viral, fungal, or bacterial, that people can acquire. So things like HIV, skin infections, bloodstream infections, herpes, anything under the sun that one person can pass to another. Doctor is a term that really, I think, means more teacher than someone who tells people what to do to improve their health. There's a lot of movement towards having, this is what you need to do to get better. I think having patients involved in that process and understanding what you're doing and why you're doing is really how you can be more successful at it, which is something at times we move away from. And as things get more complicated and the technology gets more involved and things get harder to explain, it's more and more difficult to do that. But I think knowing the whys, the hows, the risks and the benefits are all important. So I think as an educator is a central part of being a doctor. The recent advances in my field that tend to make me excited, the ones that I've kind of, for the department, become the go-to guy in. One thing is something called next generation sequencing, which is an expensive test that we tend to reserve for only when it's needed. But more and more we're using genomic data of a more shotgun approach to being able to take a blood sample and run it against a library and say that you may have this rare infection that we've never seen before, or something that's really hard to diagnose. And we've had a couple of patients where we're using technology like that. We've actually genuinely saved their lives and discovered infections that we wouldn't have otherwise have found. I'm a people person. What really fuels my passion is working with people. For a while, I looked into doing more bench-side research, and it just wasn't for me. I think having relationships with people, helping people, seeing that you are making the difference, being the difference in their life, I think that's what really fuels my passion. Outside of healthcare, a lot of my time, I have a 2.5-year-old, so going to the park with him and doing things with him, streaming television, I think everyone does now. We're big, me and my wife are big on board games and, spending time with friends, those sorts of things. And COVID put a damper on it, but definitely travel is something that we have very much enjoyed in the past. I mean, my wife and I met one another in Peru. To make an appointment with me, please ask your primary care provider to make a referral.